Okay, welcome to Psych 200 Research Methods, Introduction to Research Methods. Today, we're still on that chapter on non-experimental and quasi-experimental designs. We talked about a whole bunch of them last time we did this, and today we're going to talk about the rest of these non-experimental and quasi-experimental designs. Okay, today we're going to talk about what's called the time series design. Okay. The time series design, if you look at the top heading there, it's a within subjects this is a within subjects design. So we're on the topic of within subject, non-experimental and quasi-experimental designs. They're pre and post designs. That's the mouthful, I know. The important thing to remember is this is within subjects. You're using the same participants, okay, in all your groups, okay, if there are any groups, okay, but at least you're going to do some comparison, okay. So the time series design is a design that requires you observe, okay, multiple times before and after a treatment, okay. So if you look at the circles there and the X, right, remember that the O's there, the circles, that means observation and measurement, okay. So you observe and measure once, you observe and measure twice, 3 times, for example, and then you have some kind of treatment, and then you observe and measure again, and then again and again. So what you're doing here is you're establishing a pattern before treatment, and then you're seeing the pattern after treatment. Okay, that's what you're doing. That's called a time series design. Time series because this takes, this is extended in time. You have several observations on different days or maybe different weeks, okay? And well, it's extended in time, okay? Because you have multiple observations. The intervening treatment or event X, right? That's when you do something or something happens, right? It may or may not be manipulated by the researcher. Remember, X stands for the intervention. It could be that, you know, some relaxation training. So let's say you record blood pressure on a given day, right? And then you record on record it on a second day. You observe and record on the second day, and then on the third day, and then let's say on the 4th day, you do some you expose participants to, or you have them undergo a relaxation program, right? That's the treatment, and then you observe their blood pressure the next day, and then the next day, and the next day after that, to see if this relaxation training program has an effect. So you establish a pattern before, then you have some treatment, then you establish a pattern afterward. Now it says there that the intervening event, the X, may or may not be manipulated. It may be something you manipulate, like some program, some therapy. It could be some drug or something like that. But it may also be something that happens on its own. And in that case, it's called something different. Okay. It says there that it's called an interrupted time series design if the treatment or event is not manipulated. If the intervening event, if the X is not manipulated, that means you didn't do anything to participants, right? Then it's called an interrupted time series design. So for instance, if there's an earthquake, that's something that you didn't do. That's something that you didn't really plan, right? So you can evaluate the effect of an earthquake on the well-being of students. So you had records of basically of visits to the nurse already, let's say at a school, right? You knew how often students were going to the nurse. And then there's some earthquake that happens. And then you check, you know, school nurse visits after that, right? So that would be an interrupted time series design. It's just like the other one, except that the intervening event X, the event X, you didn't manipulate, it just happened. Because it is often impossible to predict an event, okay? Sometimes things happen on their own. And you can use archival data, in other words, data that's already recorded, already collected, to see what the pattern was before the event. And then, of course, you can then look at the pattern after the event that has happened. You can look at police records, hospital records, school records, all kinds of things. So you can see a pattern before, and then something happened, right? An earthquake or something like that, and then you check the pattern afterward. Here's the thing, this is not something that you plan. Let me give you another example. We hear about, certain things happening all the time, certain things that may be traumatic, okay? Like there's a school shooting, right? That's something that happens every now and then. Okay, we have a big problem in this country with guns and people just deciding they want to kill people all of a sudden. Okay, we have a big problem with that. There's school shootings or shootings every now and then. People don't really know when that's going to happen. Okay, but it happens, and then some, very clever psychologists decide that, oh wow, we have one of these events, right? Let's go see. Let's go check the records of students. After this event, right? Let's go check the records and see. Let's see how often they need to see a counselor or the school psychologist or something like that, and let's track that for a while. And let's see if this event actually did anything. And then you can compare that to the records before that happened, before the school shooting, right? Because you have records of how often students see the school psychologist or want to see a counselor or something like that. That would be an interrupted time series design. There are things like that that happen: earthquakes, school shootings, a terrorist attack. And trust me, there are psychologists that take advantage of these events, in a sense, and use this to study, how people respond to them. There's another example, the 9/11 terrorist attack that you guys have heard about. Some of you maybe lived through it because you may be old enough to remember that. A lot of you are probably too young and it happened before you were born. Some of you probably, or you were too young to know what was going on, but that's something that happened. Okay, and you know what happened after that event? You know what psychologists noticed and other people noticed? Church attendance went up after that terrorist attack. People were scared. And when people are scared, well, they start going to church more. They turn more to God. Okay? They had records of church attendance before, and then there was a terrorist attack, and they look at the church attendance afterward. That's a perfect example right there of an interrupted time series design. So these things happen, and that's an intervening event, and you kind of take advantage of that to some extent and see what changes take place afterward, because you have records of what was happening before through archival data. Let's keep going. More about the time series design. So you can see a trend before treatment, right? You have records, let's say, before there's any treatment. Okay, maybe those records were already collected, it's archival data, or maybe it's things you collected yourself, like you were checking blood pressure or whatever it is on your own, right? So that trend that you can see before treatment, that's called a time-related factor, right? Those are due actually to time-related factors, okay? If you see a trend, that means it's due to whatever was happening at that time. That's what that means. If you do not see a trend, that means there's no time-related factor. So for instance, if church attendance was steady, there's no trend, there's no increase or decrease. Remember, that's what a trend means, okay? If there's no trend, okay, if things are stable, steady, that means there's no time-related factor. There is nothing that is happening that's impacting, let's say, church attendance, or that's impacting blood pressure or whatever it is. There's no trend. You have a stable pattern. But if you see a trend, that means there's something happening already that's causing changes. So you want to be aware of what's happening, okay, in these when you're observing or you're measuring these things. If there is a trend after treatment, let's say there's an event, something you manipulate, or something that happens on its own, it doesn't matter, right? If there's a trend afterward, if there's a pattern, a consistent increase or decrease, right? That means that something could have happened after treatment, okay? So it could be that the treatment effect remains, right? Improves or fades. So let's say there's some treatment, right? Some relaxation training program, and you want to see if the treatment effect remains. Do people remain relaxed, on the different days that you observe and measure them? Or does it get better? Do they find better ways to cope and then are even better able to relax? Or does the relaxation training program kind of fade? It works right after, right after they do it, but then with time, they're just as anxious as they were before. Let me give you a better example, again, with church attendance, right? We knew of the pattern of church attendance before 9/11, before that terrorist attack, okay? And there was a stable pattern there. And I don't know what the percentage of people is that go to church, but there's a certain percentage of people who go to church. Most people do not, by the way. Okay, certain percentage of people who go to church. And then 9/11 happened. You had that terrorist attack, scared a lot of people. People thought they were going to die and we were going to go to war and all those things. We did go to war, but people were scared. Okay, that's the intervening event. What happened after that to church attendance? Okay, so there was a spike in church attendance. Church attendance went up. Now, did the treatment effect remain? Did church attendance continue to remain high? Did it go even higher? Did it improve or did it fade? And you know what happened? It remained high for a little bit, but then it faded and it went back to normal. That's the way people are. They get scared, they change, and then they go back to whatever they were doing before. That's the nature of people. They get used to things and they go back to normal. Same thing with the coronavirus. People were scared at the beginning and they were wearing masks. They were staying away from people, right? Because they were told about that. Let's say that was the treatment, hearing the news about that, about the coronavirus, and that people could die and all that stuff. And you were told to use masks and all that stuff. That was the treatment, right? A lot of people use masks, practice social distancing, didn't go to stores and stuff like that for a while. And then after a while, it faded. People weren't so scared anymore. They stopped wearing masks. They stopped practicing social distancing. They're doing what they were doing before, even though we're still being told that it's dangerous and we need to be careful. People have gone back to normal for the most part. Only about 20% of people are actually following the rules very strictly. And I know this because of driving patterns. Driving went way down right after we got scared about the coronavirus. And then as we got used to it, it went back up. And now we're back to like 80% of normal. Okay, so only about 20% remains, so to speak. And that's why it's getting worse, because people are no longer following the rules. People are not that careful anymore. And you see what's happening. We have more and more cases, more and more people dying. And until we get this vaccine, it's going to continue because we're irresponsible and we don't follow the rules. We only do so for a period of time and then we go back to whatever we were doing before because we don't like change. Right? We don't like to continue doing these things. That's another example there. The series of observations allow researchers to minimize most threats to internal validity. So because you can see the pattern before treatment and the pattern after treatment, you can see if there's something else that's affecting cause and effect, right? That's leading to the effect that you see. Remember, internal validity has to do with cause and effect. So you can see if there's something happening before treatment, right? You can see the pattern and you can see the pattern after treatment. You can see if there might be something else that's actually causing the effect other than the treatment or other than the event that happened. The time series design is called quasi-experimental because it does make some attempts to minimize the threats to internal validity. You're not just comparing groups, you're actually doing something else that's more useful. More about the time series design. The external event, which is a type of history event, right, is only an external event, a type of history event or a potential confound. It's only a threat if it occurs simultaneously with the treatment. If there's something else that happens, okay, it's only a confound, it's only a threat to cause and effect to internal validity if it happens at the same time that the treatment happens. So an example here, you can evaluate depression. Depression, you look at the pattern before treatment, then you have a treatment, right, some therapy, and then you look at the pattern afterward, okay? So you can evaluate this depression treatment. So you observe for a week before treatment, and you have the treatment, and then you observe for a week after treatment, and you can look at the pattern. If there's a sudden change in the weather, because weather can make people feel better, right? We've been having nice weather lately, and it makes people feel better, right? If there's a sudden change in the weather, the same day the therapy begins, then it's impossible to determine what caused the improvement. Did the treatment cause an improvement or was it the weather? It happened at the same time. You don't really know. And, but remember, it's only a threat if it happens at the same time. So here's a graph over here. You have 3 observations before treatment. Let's say you're measuring blood pressure there. 01, observation 1, observation 2, observation 3, and then you have some treatment, let's say. Maybe the treatment is some, relaxation training program, and then you check, right, the You check blood pressure after the treatment, 04, 05, 06, and you can clearly see there that it's not working. People are getting more stressed out. Blood pressure is going up. Okay, but that's an example of just, having a pattern of observations that people's blood pressure is going up. They're getting, let's say, more stressed. And then you try to put in some treatment to calm them down. And then you see the pattern afterward. And you can clearly see here that it didn't work. Let me give you a better example of this. The whole coronavirus thing, okay? The cases were going up. So let's say 01, 02, those are the measurements, right? We had this many cases on day 1, this many cases on day 2, day 3, and then we had the treatment. They came out on the news, hey, we have this virus. You guys need to practice social distancing, wear some masks, be careful, wash your hands, and do all that stuff, right? That was the treatment. They told you guys that. And then they watched the pattern of cases. And you know what happened? This is exactly what happened. It continued to go up. So in other words, the treatment didn't really work. Now, that doesn't mean that the treatment doesn't work. What it tells us more, I think, is that people aren't really following the recommendations. There's too many people who are not following the rules. And as you see, our president has made it political, wearing a mask and all this stuff. There's a bunch of people saying, F you, I'm not going to wear a damn mask. I don't give a damn. This thing is just like the flu. It's not that bad and all that stuff. So you have a bunch of people who don't believe in wearing masks. And even those of us that do are not being that responsible about it. So the cases have continued to go up. That's what happened. I saw the pattern at the beginning. They continued to rise. But then after a while, they went down because it probably took some time for the pattern to reverse. Because remember, it takes about 2 weeks in which you can develop symptoms. So at the beginning, it didn't seem like it was working. And then it kind of peaked sometime in the summer, and then it started to go down. And then what's happening again? It is going up again, much faster than ever. Why? Because people have gotten used to it. People have gone back to work. They're not following the rules. They're starting to see their family members and their friends. The holidays are coming up, and it's going to get even worse. Because the treatment effect, if there was any, has faded. Now, here we have other graphs. If you can see these that show other patterns. So you can see over here, like the one on the upper left, right? You can see the observations on day 1, let's say observations on day 2. And then on day 3, there was a sudden increase. Something happened. There was an outside event. Maybe the weather got better. If we're talking about, let's say, happiness, let's say, how good you feel. Maybe the weather got better and people felt a lot better. And then you have your treatment, which is the dotted line there, which let's say was some type of therapy that's supposed to make you feel better because you're depressed. And then we see the observations afterward and people feel good, okay? In that case, we know what the outside event did. We know the outside event increased well-being or happiness without the treatment, because we see it. Before the treatment, we see that that dot is up there, right? And then the treatment came in, and the treatment seems to have done nothing because the pattern remains. So there we can, if there's an outside event, a potential compound, we know what it's doing, okay? So we can tease out the effect, and we still know what's happening. Here we have another pattern on the upper right, right? We have observations on day 1, day 2, day 3, right? Let's say happiness, well-being, whatever is remaining about the same. And then we have the treatment, the dotted line there. And then we have observations on day 4. It didn't seem like the treatment did anything. And then some outside event happens. The weather gets a lot nicer. And then all of a sudden people feel better. So then the dots are way up there. So again, there, we know the treatment didn't do anything, and we know that outside event did do something. The point is here that if the treatment event happens before, if the outside event, the potential compound, let's say, happens before treatment, if it happens after treatment, then we know what it's doing, and we can still explain what is happening. It is a problem if the outside event happens at the same time as the treatment. So if you look at the graph at the bottom there in the middle, right? You have observations on day 1, day 2, day 3. So let's say happiness, well-being is remaining about the same. It's level. And then you have a treatment, the dotted line there, and an outside event at the same time. And after that, you see the change in well-being, the change in happiness. In that case, you don't know if it was the treatment. You don't know if it was the outside event. So in that case, you have a problem. you cannot explain the results. So you have a threat to internal validity. You don't know what's causing what. That's the point. An outside event, right? Something else that happens other than the treatment is only a problem if it happens at the same time as the treatment. If it happens before or after, then we still know what's happening. Let's keep going because I'm going too slow. Let's talk about other designs. Okay, that was all the time series design. Let's talk about single case, single subject applications of this time series design. You can do a time series design with a single person, by the way. So that's what we're going to talk about. So the time series design can be used to evaluate one individual or one organization. You can test one individual and not a whole group of people. Or you can test an organization. It could be a certain business. It could be, you know, Antelope Valley College, or maybe the corporation, you know, Google, or whatever it is. Whatever it is, we can test an organization or a single person. That's a single subject or single case design. So you can evaluate, for instance, the effect of anger management, if an anger management program at a high school. You note the number of fights before the program and after the program. So you know there are patterns before the anger management program was put in place. There's records of fights breaking out, of problems at the school. And then you start this anger management program, and then you note the number of fights or the number of problems after that. And you can see if it had an effect. Another example would be you can monitor compulsive behavior in a patient before and after therapy. Compulsive behavior means basically, think of that like obsessive compulsive disorder, right? OCD, where they keep, washing their hands over and over again, right? So you can note the pattern before, and then you start some treatment. Maybe in this case, the treatment is a drug that's supposed to relax them, okay? Because it is an anxiety disorder when you have OCD. And then you check, see how often they wash their hands after after they start that drug treatment. Okay, those are examples of single case or single case, single subject application of the time series design. There's also cross-sectional research. If you were in my Psych 101 class, you've heard about cross-sectional research before. So some of this is going to be a little bit easier. Some of this is going to be review for some of you if your instructor went over this in Psych 101. Cross-sectional research sounds complicated, but it's not complicated. Cross-sectional research is between subjects design. Oh, by the way, it says on the top there on the heading, these are developmental research designs. These are designs, research designs that are used usually when you study people over time, like in developmental psychology, or lifespan development, lifespan psychology, something like that, right? So a cross-sectional research design is a between subjects design. You use different people for different groups, okay? So you use a separate group of participants for each age being compared. A cross-sectional research design, all it does is it compares people of different age. So you can measure, let's say, the IQ of people at age 40, 60, and 80. You can give them an IQ test. Give people who are 40 years old an IQ test. Give those that are 60-year-olds an IQ test, and those that are 80-year-olds an IQ test. Same IQ test. And you can see if, how IQ kind of changes over time to some extent. Do people do worse as they get older? Are the 80-year-olds doing worse? Are the 40-year-olds doing better? How are the 60-year-olds doing? So you can see how IQ, or intelligence, if you want to call it that, if that's what it represents, if you believe that, how it varies over time. All you're doing is comparing groups, on a given thing, okay? You're comparing people of different age on IQ in this case. You can also compare people of different age, let's say, on how they vote. You can compare people of different age on how they drive. When you basically just use age of your basis for comparison, that's called a cross-sectional research design. You can look at, for instance, rates of divorce among 40-year-olds, 60-year-olds, and 80-year-olds, right? Any kind of thing. But what you're doing is you're comparing people of different age to try to determine how people change as they get older. This is considered non-experimental, by the way. You're just comparing different groups. The groups are not equivalent, right? It's a non-equivalent group design, and there's no random assignment. All you're doing is comparing people of different age. That's called a cross-sectional research design. In my Psych 101, I give the example of gay marriage. how people vote on gay marriage. You can compare those that are 40, 60, and 80. And you know what you find, what the research says? People who are younger are more likely to support gay marriage than people who are older. What does that say about us? That as we get older, we get more set in our ways, less accepting of differences, less tolerant of differences? Or does it say something else? The thing is that, there can be confounds, and we'll talk about those in a moment. Here's a visual on, remember on how this is a visual on how a cross-sectional research design would work. You have a population, and then you select different people from that population. You have your 40-year-olds on the left, your 60-year-olds in the middle, and your 80-year-olds on the right there. And you're just going to compare those different people, 40-year-olds, 60-year-olds, 80-year-olds, when it comes to how they vote, their eating habits, their blood pressure, anything really. You can see how those things change over time depending on what you decide to study. Now, it doesn't have to be 40, 60, and 80-year-olds. It could be 20-year-olds, 40-year-olds, and 60-year-olds. But all you're doing is comparing people of different age. And you're hoping that this will tell you something about how people change over time. That's why it's called a developmental research design. You want to see how people develop over time. But there are problems with this design, of course, that we'll get to in a moment. First, we're going to talk about the strengths. Strengths of a cross-sectional research design. You can examine changes in behavior over time. They give you some clue about what's happening over time as people get older. And you don't have to wait for participants to age. You don't have to wait for them to get older. You just compare people of different age. You can collect data during a short period of time. You can have your 40-year-olds and your 60-year-olds and your 80-year-olds all in one room, and you give them the IQ test. All right, you have 1 hour to take this test. 1 hour, you're done, and you have your data. Okay, you can collect it in a short period of time. There's no need to encourage long-term participation. They don't have to come back. Okay, you don't have to track participants over time. All you're doing is measuring something for people of different age. That's all you're doing. So it's easy in that sense. There are some problems that I was itching to get at, and I was trying to get ahead of myself, but here are the weaknesses. Weaknesses of cross-sectional designs. You cannot say how the changes occur over time. So there are changes. Maybe you see that there are changes over time because your 40, 60, and 80-year-olds seem to be different in whatever you measured. But you don't know how people are changing. There's outside factors that could be affecting the groups. There are threats to internal validity, to cause and effect. What is causing these differences that you see? It could be a cohort effect or what's called a generation effect. There are differences between the groups due to their unique experiences. Guess what? Your 40-year-olds, 60-year-olds, and 80-year-olds have had different life experiences. They grew up at different periods of time. The 40-year-olds have grown up with a lot more technology, a lot more information, and they're more likely to be tolerant because they've had different education than the people who are 60, the people who are 80. People who are 80 especially grew up at a very different time. They grew up without computers, right? So if you compare 40, 60-year-olds, let's say on computer literacy and how much they know about computers, how well they handle computers, right? You'll find that 80-year-olds do a lot worse than 60-year-olds, and that 40-year-olds do the best of all. Does that mean that as we get older, we are just worse at using computers? Or does it really mean that, that if you're older, you probably didn't have the advantages of people growing up today who grew up with this technology? That's a cohort effect, right? They had a different life experience. They grew up at a different generation. And it's the same thing with voting, okay? When it comes to voting on like gay marriage, the 80-year-olds all grew up when gay people were all in the closet. Very few people came out and say, yeah, I'm gay, and accept me. 60-year-olds, well, they had some, a little bit more exposure to gay people. If you're 40, 40s, people like me, then you've known for the last, several decades that people have been coming out and saying, hey, I'm just like you, please accept me, and all that stuff, right? We know about that and we accept them more, and we're more likely to believe that they should have the same rights as the rest of us. Doesn't matter that there's a man who wants to marry another man or a woman that wants to marry another woman. They're people just like us, and they want to have the ability to get married. For some people, that sounds awful, right? To those 80-year-olds or maybe those 60-year-olds, because they learned very different things. All they knew about gay people was what they heard of from other people, which were very bad things, and what they heard in church, that gay people are sinful and they're going to hell, and that's what they heard, right? That's not what we know about gay people today. We know much more about homosexual and all that stuff. And we know that they're just like the rest of us for the most part. They just happen to be different in who they're attracted to, okay? But that's an example. The example with the computers, 80-year-olds grew up without computers, so it's not fair, right, for them to get this computer literacy test. They're going to do a lot worse, right, than 60-year-olds and then 40-year-olds. So the differences that you see, what do they do to? Does it really mean that people change that way over time? Or does it mean that people grew up at different times and had different experiences? And that's what's causing the results that you see, right? So it's a study, it tells you something, but you don't know, you often don't know what it's really telling you. Here's another one. Oh, here's the thing, example about gay marriage. Should gay marriage be legal? Now, the number that you see on the left, the percent supporting it, and the number you see on the bottom, the horizontal thing, that's the average age. I couldn't put in the average age. I created this in Excel. I couldn't put in the average, no, I mean the average, the range. So the first group is supposed to be like people who are 20 to 25. And the second bar is supposed to be like 30 to 40 or something, no, or 35, another different range, okay? And so I couldn't do that, so I just put in the average there. Okay, and you can clearly see that as people get older, they are less supportive of gay marriage. What does that tell us? Does that mean that as we get older, we're just less tolerant, less accepting, more prejudiced? Or does it really mean that those people grew up at a different time and learned different things about gay people than people who are younger? You're more likely to accept gay people and believe they should have the same rights, like the right to marry, right? If you know about them, if they're your friends, if they're your neighbors, and things like that, if they're out and you know about them and you learn, hey, they're not so bad, right? They're just like us. Those older people, they were taught very different things. The only thing they knew about gay people was the stuff they heard in church and the stereotypes that they heard from others, because gay people were in the closet at that time. This reminds me about something else I just want to mention as a little aside. You know what? I'll save it because I don't want to mess up the lecture. Okay. But it reminds me about something. Okay. There are certain people also nowadays that are in the closet. Not all of them, but a few people, small percentage of people are in the closet about something. And if you remind me, if I remember, I'll tell you guys after the lecture. Okay. But I think it explains something about our society. It's just something I thought of, but it's not that relevant. So I'll save it. Another type of research design is called the longitudinal research design. This is when you actually study people over time. Okay, so it measures a variable in the same group of people over time. So here you track people over time. That's why it's called longitudinal. These individuals are called cohorts. Okay, they're roughly the same age and they have similar circumstances. So in this example, we would measure the IQ of a set of individuals when they are 40, 60, and 80. So here we're not comparing people of different age. Here we find people who are 40 years old and we measure their IQ. And then we wait 20 years and we measure their IQ again. And then we wait another 20 years and we measure the IQ again. So we study them over time. That's longitudinal. This is a within subjects design. It's the same people we're studying over time. And it's also a one group pre-post test design. It's one group of people. We studied them before, we studied them after and after. So it's like pre and post test. There's no treatment administered. The treatment is age. We don't do anything to them. We just wait for them to get older and then we measure whatever we're interested in again. Here's an example. The number of cumulative offenses. I made this up. I'm not saying this is accurate. I know about the research, but I don't know the specific numbers. Okay. So number of cumulative offenses. So people committing crimes and getting arrested for them and getting locked up for it, let's say, right? You can see that, okay, I start at 20. You're young. And when you're young, you tend to cause a lot of problems. And then your your offenses tend to go up, right? And then by the time you're 30, you've gotten into trouble more times, gotten locked up more times, let's say, right? And then it keeps going up, it slows down a little bit and keeps going up until you're 40. And then something happens at age 40. At age 40, it's like people are older, it's like they're tired or something, and they kind of level off and they stop causing problems. And that's what you find among people in prison, people who get in trouble, is that they mostly get in trouble when they're older. I mean, when they're younger. When they're younger, they keep causing problems and they keep getting into trouble. They keep getting arrested and locked up. So that's why the curve goes up, okay? It goes up as they build up these offenses. And then after a while, they stop. And it's like, I'm old, I'm tired. I don't want to be doing all that stupid stuff anymore. That's what happens. There's not a lot of people who are old in prison. There are people who are old who continue to cause problems, and those are called lifetime offenders. The majority of people who cause those problems and who get locked up are young people. They're the ones selling the drugs. They're the ones doing the killings. They're the ones doing all this illegal stuff for the most part. And then after a while, they get old and they realize, you know what? I don't think I want to do this anymore, right? I'm kind of tired now. And that's what happens. So it levels off after a while. You stop doing all that stupid stuff. And I'm not saying that everyone in jail, by the way, is in jail because they deserve to. There's plenty of people who falsely accused, falsely imprisoned, and in prison for stupid stuff that they shouldn't be in prison for. Okay? Yeah, in prison for like smoking weed. Come on, get it the hell out of here. I mean, that's ridiculous. Okay? But, you know, but there are people who are in there for committing serious offenses as well. Okay? But that's an example of longitudinal research. Longitudinal research, the strengths, okay? No cohort effects with longitudinal research. No, there's no problems with having people that grew up at different times, different generations. Okay, there is no problem with that because it's the same people that you're following over time, or that you're testing over time. So there's no cohort effects. They're growing up at the same time. Okay, you're not comparing people who grew up at different times. It's the same people, and you're just waiting for them to age. You can examine change with age. Okay, weaknesses. Well, there are some problems. It's very time consuming. Imagine, right? You start and you first, you know, find a group of people when they're 40 years old and you give them an IQ test. And then you wait 20 years and you give them an IQ test again, those same people. And then another 20 years and you give them an IQ test again. 40 years. Here's the thing though. In those 40 years, it's not like you're just going to be sitting around doing nothing. You're going to be doing other research. You're going to be doing other work. While these people age, you're going to be active. Okay, you're not just going to sit there for 20 years, right? But yeah, when the time is up, then you're going to track them down again and you're going to measure them again. And it's expensive. The researcher must track down participants and persuade them to participate. You have to track down these people again, find them, because people don't stay in one place always. A lot of them move, people change their names, all kinds of things happen, and you have to find them and track them down and convince them to participate. And that can be expensive. Offer them payment, you know, some incentive to participate, and also trying to find them, you know, that requires time and effort. Other weaknesses, participant attrition, mortality. What that means is people drop out of the study. That's attrition. People drop out of the study. They say they don't want to participate anymore. So they're not interested 20 years later, 40 years later. Or mortality, right? Some of them actually also die. And then they can't be in your study. So they can be a high dropout rate due to loss of interest in the study, or because they don't want to participate anymore, or because they move and you can't find them, or they actually die. That's real mortality. So the group that you're left with 40 years later can be different than the original. So maybe you start out with 100 individuals when they were 40, and then you track them down when they're 60. You track some of them down, you try to convince them to participate. So you track down when they're 60, let's say, and when they're 60, now you only have, let's say, 60 of them. Okay, and then you track them again when they're 80, and now you only have 40 left. You've lost most of them. That's what happens. There's a high attrition or mortality rate. Doesn't mean they all die, but it means that you lose a lot of them, one way or another. Testing effects can be due to repeated measurements of the same individuals. There's also testing effects. You test the same individuals multiple times, and they've seen the test more than once. So because of that, they may get better at it, or they may not take it seriously, whatever it is, but that's a testing effect. Here's a visual for you guys so you understand a little bit more. There's a sample of 40-year-olds, right? You give them an IQ test today, and then 20 years later, you track them down, give them an IQ test again, and then 20 years after that, when they're 80, IQ test again. And over time, as you try to convince them, track them down, you're going to lose some of them. And it's practically impossible that you're going to have the same people you started with. You're going to lose a lot of them. So therefore, the group that remains at the end may not be the same as the group you started with. Actually, it won't be the same. And so you got to ask yourself, okay, is the change that I'm seeing due to, this is the way people age, right? Due to that, due to age, or is it really due to the fact that I have different people left? And these people are different than the ones I started with. So that's a problem. Strengths and weaknesses of cross-sectional and longitudinal designs. We talked about those. I'm not going to say them again. It's just a graph to organize that information for you guys, you know, in case you're interested. There are also what we call cross-sectional longitudinal designs, not cross-sectional designs. I mean, not cross-sectional designs. That's one type of study, not longitudinal, but combining both cross-sectional longitudinal designs. They're also called sequential designs, by the way. So this is when you combine both cross-sectional and longitudinal designs. So here you compare the results obtained from separate groups of individuals, from people of different age. So it's like cross-sectional design, but you obtain them at different times. You track them down over time. So it's also like a longitudinal design. So you can study 25, 35, and 50-year-olds, people of different age, and you measure something about them in 2005, in 2010, 2015, 2020. You study them over time. So you study people of different age over time. That's combining both cross-sectional and longitudinal designs. You can see how computer education affects computer skills. So you give them some type of computer education, right? And you do that in 2005, in 2010, 2015, 2020. You track down people of different age over time, and you do this over time. And you might find something like this, that your 25-year-olds, their computer skills continue to get better. 35-year-olds, they get a little bit better, they level off and they get better, you know, and then your 50-year-olds, they get a little bit better and then they kind of level off and they don't get much better after a while. You might find something like that. So it's a more complicated design. You have people of different age that you are tracking over time. So it's both cross-sectional and longitudinal. And here are, here's a review of a lot of the different designs that we talked about. Remember, there were non-experimental ones and quasi-experimental ones, just a table to organize that for you. And here's another one over here for you guys. I'm not going to go over that. We already talked about it. Okay, it's just to help you organize your thoughts there with some tables. All right, I'll stop there. So let me stop recording.